Dr. Sam here with another edition of Talkin' Teens, and today we're going to be busting some myths around ADHD and teenagers. So if you're a parent of a teenager with ADHD or wondering if your teen may have ADHD, then this episode is for you. Attention Deficit Hyperactivity Disorder, commonly referred to as ADHD, is a chronic neurodevelopmental condition defined by difficulties with attention, hyperactivity, impulse control, or any combination of the three. ADHD is one of the few mainstream mental health diagnoses, meaning there's a lot of public awareness around it. On one hand, this awareness can be a good thing, as it drives the market for producing effective treatments, resources, and accommodations for teens with ADHD. But on the other hand, this level of public awareness leaves the door wide open for misinformation to creep in. As a parent, caregiver, or anyone who works with teens who have ADHD, it's good to know what's true and what's not true. So here are my top 5 myths around teens and ADHD. Myth number 1. ADHD is not a real disorder. So some folks out there believe that ADHD is nothing more than a social invention or a quick way to label teens with behavioral problems. While misdiagnosis can certainly occur, decades of evidence show that ADHD is indeed a biologically and genetically influenced condition. From neuroimaging studies showing differences in brain development and genetic studies suggesting there's usually a strong family history of ADHD, there remains little question that ADHD is a real disorder and should be taken seriously. Myth number 2. ADHD is far more common in males than females. Now, there is a kernel of truth to this. While the research suggests that male children with ADHD outnumber female children by about 2 to 1, this difference drops a little bit by adolescence and even more so by adulthood. Apart from that, many psychologists believe that males with ADHD are easier to identify compared to females. Adolescent males with ADHD are more likely to show the in-your-face behavioral symptoms, such as aggression and impulse control problems, whereas females are more likely to display the subtler features of ADHD, like inattentiveness. So in a nutshell, it's possible that adolescent girls with ADHD are less likely to be identified. Myth number 3. Children tend to outgrow ADHD as they reach adolescence. So the research actually shows that anywhere from 50 to 80% of children with ADHD continue to meet criteria as they become teenagers. However, it's important to know that symptoms like hyperactivity and impulse control do tend to improve a bit with age. But even with this natural improvement, ADHD as a whole typically continues into adolescence. Myth number 4. Attention problems equals ADHD. It's easy to see a teen who struggles to pay attention and assume they have ADHD, and this very well could be the case, as difficulty maintaining attention is a core feature of ADHD. But attention problems aren't specific to ADHD. For example, teens often have difficulty concentrating due to depression, anxiety, or even a specific learning disorder. So whether it be with a psychologist, a psychiatrist, or your pediatrician, it's important that your teen undergo a thorough assessment to ensure proper diagnosis of ADHD. And finally, we have myth number 5. Medication is the only good treatment for adolescent ADHD. First off, I do want to make it clear that there's a ton of research to show that medication can greatly improve the lives of teens with ADHD. But medication isn't the only research-supported treatment available. From behavioral parent training, behavioral classroom interventions, organizational training, even to behavioral peer interventions, there are many psychosocial treatments with strong scientific support. So if you're not quite ready to try medication, there are other options out there.